Premier Hورگان, thank you very much for taking the time out of your busy schedule for this interview as we are approaching the end of our calendar year. This is part of a series of interviews we, Hamiari Media, are doing in partnership with BC SARF. First and foremost, congratulations on your successful treatments. For the beginning, I would like to ask you if you could share with us about major achievements of BC government during the past Iranian calendar year, basically since March 2021.
Sure. Well, first of all, it's a great honor to be here with you today, and Nowruz Atan Piruz to your audience and to you and your family. It is always a great opportunity to celebrate the beginning of the new year, the cleansing and beginning anew. And British Columbians have been through so much in the past number of years. You asked me about the past calendar year, the past 12 months, but we think about the global pandemic. We think about successive fire seasons, horrific floods, the breaking of our infrastructure, whether it be the Coquihalla Highway or Highway 1 through Abbotsford with floods. We have been hit with extraordinary tragedies. The whole town of Lytton is gone. Only 2 people lost their lives, but the entire village is gone from the landscape and needs to be rebuilt. It's been a very, very challenging year for British Columbians. But despite that, I would say that our greatest achievement as a people has been holding together during these challenging times. COVID-19 has been extremely challenging for families, particularly families that have elders in long-term care, and the challenges of being able to visit with your loved ones during these difficult times. Despite those obstacles, British Columbians remained focused on helping each other in times of tragedy, like the flooding in the Fraser Valley or the fires in the north. And I think that's the real testament to all of us, not just government, but to all British Columbians through this very, very extraordinary time, unprecedented in my lifetime. We all hung together, and people were happy or sad, depending on their circumstance. But at the end of the day, everybody understood that the best way forward was to come forward together, and that's what I'm proudest of.
Okay, great. Thank you. This year, Canada faced protests by thousands of truckers participating in the so-called Freedom Convoy, fighting with COVID-19 mandates. These protests has also spread to the provincial governments. Recently, some leaders and organizers of these protests announced that they are going to head to Victoria from all across Canada. And the plan was that they come here yesterday, but apparently they changed the plan and they are going to come here this weekend, and they changed their destination to Vancouver. And they are planning to stay here for months. In response to this news, in a statement, part of your statement, you mentioned that 94% of British Columbians are vaccinated.
Adults.
Adults, yeah. Yes. The question is that, do you believe all protests and those who are against restrictions are among unvaccinated people? Do you have any plans for meeting with them to hear their points?
Well, I have no plans to meet with them unless they have a point to make. It's been my view as I've watched these protests emerge. When I looked at what was happening in Ottawa, for example, it wasn't really about mandates. It wasn't even really about truckers. 90% of those truckers that crossed the international borders to keep our supply chains open, to keep food in our grocery stores, were working every day. The truckers that I know were just getting on with the job. They were in their cabs, putting on thousands of kilometers, going to pick up goods and bringing them back to British Columbia. So as I saw a handful of trucks parked on the side of the road in Ottawa, I saw a whole bunch of other people that had, swear words about the Prime Minister, and it was more politics than it was about protest in my mind. And I come from a political party that was founded on protest. The NDP came from an uprising on the prairie in Canada in the 1930s. to protect farmers and to protect workers. I've been to more protests than I can remember, personally. But at the end of the protest, you go home. And you can disagree with someone without being disagreeable. And what I've seen in this movement is more politics, more directed at an anti-government stand than it is about the value of vaccines or the sacrifices that businesses and workers have made over the past 2 years. We've tried to keep businesses open. What differentiates BC from other parts of the country is that rather than shutting things down, although there will be those who disagree with this, we worked with business, whether it be large businesses to keep big industrial projects going in the north, or working with the restaurant sector to ensure that people could comfortably come and get a meal at a local restaurant. We brought in new liquor regulations so that businesses could keep operating to try and find a way to make a buck. Our real estate sector is exploding, as you know. The cost of housing is a big, big challenge, but there's lots of properties on the market, lots of people buying. There could be more on the market that would bring down prices, that would be good, but the economy is red hot. We have the lowest unemployment in the country. We have more people working today than were working before the pandemic began. So at this point, when we've already told the public that we're relieving the last of the restrictions, the mask mandates are coming off in public places, not because of protesters, but because Dr. Henry has told us that the science dictates that. Because so many people are vaccinated in British Columbia, because the Omicron variant is not as virulent in terms of its impact on people, although people are still dying and people are still getting sick. I think it's important that we recognize that. But the evidence that our hospitals are not going to be overrun is pretty clear. We have fewer and fewer people in hospital, fewer people in ICUs. That's why we put these restrictions in place, not to restrict people's liberty, but to keep people safe, particularly vulnerable populations, our seniors and people with immune-compromised systems. So when I see truckers, as they're calling themselves, and they're not really truckers, wanting to just say they hate government, you can do that without parking in someone's front yard. You can do that without honking your horn all day. If you have a disagreement with the government, that's fine. Absolutely, in a free country, come and make your case, but don't stay. Go home at the end of the day. That's what I did, and that's what most protesters do. Those who want to dig in and encamp or occupy, that's taking our liberties away, other people's liberties away. And that's when I draw the line. I think that's where most British Columbians draw the line. You want to protest? Fine with me. But don't get in the way of my rights to move around in my city. And that's what Victorians are saying. That's what people are saying, not just about truckers, but other protesters who are, whether it's climate change or old growth forests or any number of things. When you're blocking the free movement of people, you're no longer protesting, you're violating their rights. You want to come and yell at the government? Go ahead. I'm fine with that. But when you're finished yelling, go home and let people get on with their lives.
Okay, thank you. But sorry, my question was that do you believe all people participated in these protests are among unvaccinated people? Because I was watching a short video, guy was explaining that he's vaccinated, he's not against vaccination, but he has problem with getting stuck in lineups, crossing the border, and the time that he spends in those long delays, he was wondering who's going to pay for that time. That was their problem.
Right.
So
those are valid concerns, and those are issues that affect the federal government. The federal government manages our borders. We talked about that before the interview began, that we don't have in British Columbia an ability to stop people from moving back and forth between BC and the Yukon or BC and Alberta. And the federal government manages our international borders, whether it be our airports, people coming in, or our truck routes or our transportation routes by road. So if people have a grievance with Ottawa, write a letter, make your case. They did that. And those restrictions are being relieved, again, as the evidence and the science shows that it's safe to do so. Again, if people have a legitimate concern, I'm happy to listen to it. If they just want to say, I don't like the result of the last election, your only recourse is to wait for the next election. And that's what people have been doing, I've been doing, and others have been doing for a long, long time in Canada, and it served us well. If you have a legitimate grievance, if you're a truck driver who's having difficulty doing your job and feeding your family, by all means, I'd like to hear from you. But if you just want to drive around and disrupt the community because you don't like the government, then I'm not that interested in you. You should find something else to do. Useful things. You've obviously got a lot of energy, put it to constructive pursuits.
Thank you. Some people are confused about part of COVID-19 mandates to the point that makes them not trust the restrictions much. For example, before lifting the restrictions, people who wanted to go to restaurants, they had to wear face masks while before getting seated, and after that they could remove their face masks. Or last week, BC government lifted some restrictions, including wearing face masks in public places, but people still need to wear face masks when going to federal government offices like Service Canada, because federal government hasn't lifted any restrictions yet. So these kind of double standards confuses people. Don't you believe the part of the criticism and resistance against the restrictions could be because of this distrust and unconvincing justifications?
I think people are tired. They're exhausted. All of us are. We've been through the ringer for the past 24 months. And so I fully understand that people go, well, what is it today? Are we up? Are we down? Are we masking? Are we not masking? I fully understand that frustration. But the motivation from the beginning, following Dr. Henry's advice, she's a doctor, she's an epidemiologist, she's one of the most renowned experts on the planet, and we have the good fortune of having her as our BC doctor. So I've been taking her advice with Dr. Minister Dix to make sure that our hospitals didn't get overrun. Because when we looked at when the outbreak happening in parts of the United States, parts of Europe, the biggest concern at the front end of COVID, before we had any prospect of immunization programs, was that people were getting very, very sick and they were dying in large numbers. And that meant that our hospitals were filled, people were finding symptoms that drove them to the emergency room, that led to being admitted to the hospital, and then eventually maybe to the intensive care units. So our objective was to keep our hospitals operating so that we could do the surgeries that people depend on and be there for people when they need it. And as we've gone along, we've learned more. And Dr. Henry's been very, in my opinion, has been very good. Now, I have the benefit of seeing her 3 and 4 times a week and getting briefed on the state of play, who's sick, how sick are they, is it predominantly in the north, is it in Fraser Health, is it on the island? And so I've got more information than other people, but it's not like we're withholding that information. We publish it at the end of every week. And if people want to go through it, they would see the up and down of the case counts and the hospitalizations. And so now we're 2 years into this. We're taking the restrictions off because so many people are vaccinated and people are getting sick, but they're not getting as sick as they were at the beginning. And I think that's just a natural progression of the pandemic. Would it be frustrating for people to say, well, the province is doing one thing, but the federal government is doing something else? Of course. I talked to the head of the Vancouver International Airport, who's desperate to get people traveling again. I talk to so many people, I'm sure you do, that can't wait to go traveling until they think about, oh, I got to go line up at the airport. I got to make sure I've got the right test. Is my immunization going to be good to where I'm going? All of these questions. I understand that that would be frustrating. And we need to make sure that we're giving as much information as possible to the public who are making these choices. Am I going out for dinner tonight? Am I going to the hockey game? Am I going to go to Mexico for a week to get out of the rain? All of those things have an impact on these restrictions that have been in place. So I get that people are frustrated, but as time is going by, there will be fewer and fewer restrictions, and we can be criticized for maybe moving too quickly or not moving quickly enough. Mm-hmm. But I think for most people, it's just about right. They have the tools in their own arsenal to protect themselves. They've been vaccinated. They can wear a mask if they choose to. They can avoid crowded facilities. Mm-hmm. Those are choices that people can make now, and I'm quite comfortable that we're getting through this now, and as we go into the summer, people will be more comfortable. And then we've got to be worried, quite frankly, when we go into the fall, when respiratory season is on us again, we may find another spike. But for now, I think people should take comfort in the fact that everyone around them, or virtually everyone around them, has been vaccinated, and more and more every day. So I'm comfortable that we're in a good spot, but I absolutely agree and acknowledge that people are frustrated, they're exhausted, and they want to just push this behind us and get on with life.
Thank you. Back in November 2020, in your mandate letter to Minister Dix, you expected him to make progress on some items, including, quote, implement a comprehensive healthcare human resources strategy, expanding training in all fields of healthcare, and improving the province's credential recognition process and licensing so that people trained in other countries can make quickly and easily provide their skills and knowledge here in BC. The end of quote. This was such a heartwarming news, and professionals in our community were thrilled to hear about that. In the meantime, long delays in admitting patients to hospitals is a very important issue in our province. And also many people are disappointed with the lack of specialists. While foreign-trained physicians have been stopped from working in their own profession only because professional credential assessment has been a big obstacle, and they have been dealing with this issue for a long time. Why do you believe this issue has not been resolved yet, despite the fact that it has been raised and discussed numerous times during the past years, especially referring to your mandate letter to the Minister of Health? As far as we know, there hasn't been any progress on this matter. Are there any plans to push forward on this?
Absolutely, and we have been pushing forward on it for the past 5 years, not just since November 2020. And it's not just in the health sector, as you know, engineers, geologists, biologists, any number of foreign recognized credentials are not being recognized in British Columbia and in Canada. That's largely to do with the regulatory bodies, which are created by the province but are overseen by the College of Physicians and Surgeons on the medical health side, and so on. Teachers, geologists, you name it. They have their own professional credentialing organization. And we've been working with all of those bodies to try and accelerate this process, to try and make sure that foreign credentialed professionals in British Columbia can do what their passion is, what they were trained to do. We've been making progress. It doesn't feel that way today, certainly in the healthcare side. And there's a couple of other things I want to add to that. But before I get off of it, I want to just reinforce for you and your viewers and those who will hear this later on that we are absolutely committed to reducing those barriers as quickly as we can. But it isn't as easy as all of us would want it to be, or it would have been done a year and a half ago. Minister Dix has been occupied with a range of other issues. I'm not suggesting he can't do a lot of things at once. He's one of the most capable people I've met in my life, so I have full confidence in him and his commitment to this issue. But it's not moving as quickly as I would like, nor is it moving as quickly as he would like. That doesn't help those who would be listening who have a credential that's not being recognized here, and they are underemployed or they're employed in a field that they would prefer to move out of. Now, having said all of that, the part of the quote you read to me talks about a human resource strategy. And it's not just, we won't meet our challenges just with those who are in British Columbia presently who have credentials that aren't using them. We need to train more people every day. Early childhood educators to fill childcare spaces. We need more teachers now. We didn't need more teachers 5 years ago. And almost every area of endeavor requires more people. And so I've been working with the federal government to increase the transfer of money from Ottawa for healthcare. It's called the Canada Health Transfer. Provinces have been complaining about this for 20 years. It's not a new phenomenon. It's not Justin Trudeau. It's Stephen Harper. It's Paul Martin. It's Brian Mulroney, going back that far. that federal governments have been reducing the amount of money they put into healthcare, while the demand for healthcare has been going up. You talked about that in the framing of your question. And for me, this isn't about accounting. It's not about one level of government or one order of government feeding another. It's about what do Canadians want from their citizenship. And in Canada, what separates us from the United States is a publicly funded healthcare system that has some of the best professionals on the planet that are already operating within it, and we need to bring in more. That whether we train them in our post-secondary institutions or we recognize their credentials from overseas, we need more people. Our biggest challenge in every sector, and as we see unemployment dropping down to below 5%, and we see the increased demands for more workers in every sector. Whether it's we need more baristas in the coffee shops, we need more line chefs in our restaurants, we need more doctors in our hospitals. That is the biggest challenge. And how do we, in my mind, the best way to address that is through immigration. But if we're inviting people, going back to the root of your question, if we're inviting people from around the world to come here to fill our vacancies, we should recognize their credentials. That's the work of both Canada and British Columbia, and it's also the work of those regulatory bodies that I talked about earlier. We've got to stop putting obstacles in people's way and start streamlining these processes, and that's what we've been working on for the past couple of years.
Okay, thank you. Following the Russian invasion of Ukraine, we all heard about the great response from BC government supporting Ukrainians in our province, as well as putting sanctions on Russian government supporters. There's no doubt that these are very great news to hear and very heartwarming. However, it raises this question among Afghan immigrants as well as Iranian community who share the same language with them, why there wasn't such a response to the Taliban taking over Afghanistan last summer, where Canada was directly involved, was present in that country. Lives of many Afghans who helped Canadians got jeopardized. But only some funds allocated to Afghan refugees months after. Rather than that, there wasn't as much support offered to them, like extending students' visas, Afghans being here with like temporary visas, whereas for Ukrainians, it was different. Why do you think that was so?
Well, it's a very good question. And one of the things that I've been doing since the Russian invasion, the atrocities that are unfolding now in Ukraine, was I met with settlement organizations here in British Columbia who are in the business. These are not-for-profit organizations that spend all of their hours creating a volunteer base to help people who come to British Columbia. And my question to the settlement organizations was, what can we do to help you? Of course, they're all exhausted. These are people who work every day with faith organizations and others to assist with people who are coming either through the refugee stream or through permanent residency streams. And to a person, they said, we're still processing Syrian refugees. There's a long list of Afghani refugees. And now on top of that, we have Ukrainians coming. And that's not even to say about civil war in Ethiopia and the atrocities being beset upon the Tigrayan and Eritrean populations. So it's not as if the world is confined to one problem, and that one problem is Ukraine. But I think what is different about this problem, and Canadians and British Columbians have always opened their hearts to those who are in distress. That's one of the defining characteristics of who we are. We are a community of Indigenous peoples and then the diaspora from around the world. I'm the son of an Irish immigrant. We have immigrants from around the world, and that's our strength. And when we see a displaced population, we say, how can we help? But at some point, the volunteers, because this is really how the system works, are absolutely exhausted. We need more housing. We need more services for the people who are already here, but we're definitely going to need those services for the new people that are coming. Syrians, Afghanis, Ukrainians. So that's the challenge. Why is there a different response now? I would say it's largely because it's so bald-faced. The Russia acting in this way, mobilizing armored battalions and intruding into a country is something that we haven't seen in generations, quite frankly. And although the Russians started the problems with the Taliban, and they were inherited by Western democracies, that was a protracted 20-year, 30-year, 40-year exercise. Similarly, the challenges in Syria. But in Ukraine, it was, the evening news is showing battalions of tanks, an unbenevolent dictator directing them into a neighboring country. And we have obligations through NATO as a country to respond when Europe is threatened. So that, I believe, is the root of it. But the premise of your question is absolutely correct. Why not the same level of activity and action for Muslims or for Jews or for Sikhs or for others of diverse backgrounds from around the world? And it's a very good question, but I think the direct answer is Canada has an obligation as a NATO partner that if one of, not that Ukraine's not a member of NATO, but it is right beside all of the members of NATO, including Poland and others. So that mobilized a potential military response, which also mobilized, I think, a humanitarian one as well. But your question is absolutely spot on and to point, and I don't debate, I would not dismiss it for a second. You're absolutely correct. Why was there a different response? And we could talk about that all day. But there are other communities that we didn't talk about that are equally in need. And again, our heart is as big as it can be, but our capacity is severely challenged right now.
Okay, thank you. The housing market in BC has gone out of control. Many people don't even dream about having a home of their own. Some critics believe that the government is not willing to prevent price increase in housing because the taxation on home sales has been a source of income for BC government over the last couple of years. What is your take on that? Why do you believe, despite all the government has done to control the housing market, it is still out of control? Do you believe people could ever buy their own home one day in near future without any hassle?
Well, it's always been a challenge. I remember when my wife and I bought our first home in the 1980s, we had to scrape together a down payment, and the story is not that different. The down payment's much larger now, to be sure. But I think for young families or individuals who are trying to get into the housing market, it's always been a challenge. Today, it's particularly acute. Despite efforts that we put in to reduce speculation, the speculation and vacancy tax, although those who have multiple homes don't like it. Not everyone has multiple homes. Those who don't go, good. Let's not have speculators using our housing market as a commodity market. Houses are supposed to be for people to live in and to raise families and put down roots. And so we've taken steps to try and reduce speculation, and I think that's been effective. The last data I saw, almost 18,000 condominiums that were vacant are now on the rental market, which assists us in taking off pressure in that sector. But more people have come to British Columbia in the past 12 months in the middle of a global pandemic than we've seen come in over 30 years. In-migration, as it's called, from overseas, from other parts of Canada. People are coming here because they want to be here. And you and I would agree, this is a very desirable place to be. And so we can't tell people to stay away. We need them to come and bring their skills, provided we can certify their credentials, so they can be a full part of our economy. And so we want more people to come. We need more people to come, but everyone who comes needs a place to live. And that goes back to when I was speaking to the settlement agencies last week, their first, second, and third concern was housing. So we have challenges finding affordable homes in the major metropolitan areas, and it's increasingly more difficult as you get out of metro to find affordability when it comes to housing. So first order of business is more supply. Build more stock, That'll bring down prices. We talked about how red hot the market is right now. If a house comes on the market, multiple offers are in, sometimes sight unseen, and that's driving up prices. If you're a seller, that's fantastic news. But if you're a buyer, that's devastating news. And as you know, understanding the sector as you do, if you're in the market, you love it to go up. When you're not in the market, you need it to come down. And that's the challenge that government faces. There are many people who say, don't wreck my equity. My home is my retirement plan. And so they don't want to see a suppression of value on their property, but they want to make sure their children can afford to live in the same community that they are. So they want us to find that balance between suppressing prices and then allowing the market to find its place. And the cost and the value will go up based on how many houses are on the market. Extremely difficult to do. So what we've focused on instead of dealing with the home buying market is providing more not-for-profit social housing, addressing the homelessness crisis. You'll remember we had encampments in our major cities, people living in parks just down the street from where we are right now, hundreds and hundreds of people. We've found housing for all of them. There's still pockets of homelessness or people living rough on the streets. Many of them prefer that. They don't like for whatever reasons with respect to their mental health, are uncomfortable in congregate settings, they're uncomfortable indoors, they prefer to be outdoors. It's a small group, but nonetheless, they are part and parcel of the challenges that government faces when we're building housing. So we've got the hard to house, we've got those who are seeking rental accommodation, we've got seniors housing, and then we've got the open market. And it's my view that messing with the open market is always a challenge for governments because you've got to find that balance. You don't want to take away equity. You don't want to let the prices just run recklessly into the future. That's why we brought in the spec tax. It suppressed prices for a period, but now they're growing at a rate even greater than when we first came in. So we're looking at a variety of mechanisms. The property transfer tax is a component of the price, but it's not unlike a liter of gasoline. Taxation is a component that's always been there. That's not what is driving the massive increases. Scarcity is. Similarly with gasoline, we don't have enough gas, so the value of it goes up. We don't have enough housing, so the value of the housing goes up. We need to build more. We're working with municipalities to try and get approvals done faster so that the development community can do what they do best, which is build homes, whether they be in multi-family buildings or single occupancy. We need to free people up to do that work, and we need to do our level best to keep the prices down, and we're committed to doing that.
Okay, thank you very much. Premier Hورگان, in this spring, this Nowruz, what are you looking forward to?
I was looking forward to jumping over the fires today, but I am looking forward to renewal. When I think of my first Nowruz a few years ago, setting the half-scene table in our caucus room, this was the first time that had ever happened. Since we formed government, we now have a celebration at the legislature to acknowledge Nowruz. We have a half-scene table in the Hall of Honor to symbolize the renewal and all that Nowruz promises, to put the past behind you and to celebrate the unknown and uncertainty of a bold and brave future. So for me, I'm looking forward to putting COVID behind us to the best of our ability. I'm looking forward to addressing the challenges of recognizing foreign credentials, keeping housing costs down, and making sure that the protesters who are driving in circles honking their horns find something useful to do with their time. That's my hope. That's my hope for the spring and the new year ahead.
Thank you very much.
Thank you.
We really appreciate your time.
It's great to talk to you. Thank you for your questions.
Thank you.